Hello, Kimmy. I'm Adele. I'm the psychiatric mental health nurse practitioner um, in your session today. It's a pleasure to meet you.
Nice to meet you.
So, thank you for coming in today. I appreciate you taking the time to talk. Before we begin, is it okay if I ask about how you're feeling right now and let you know what I'd like to cover?
Okay.
I want to make sure you feel safe here. If anything comes up that worries you or involves risk, I'll check in and we'll make a plan together. Does that feel all right?
Yeah, that's fine.
Perfect. So tell me, what's been most on your mind about your eating, your weight, and college? I'm here to understand your experience.
So I lost a lot of weight since college started. I mostly ate once a day and I'm only eating certain things, and my mom made me come.
Okay. Sounds like the move to college was really hard and you've noticed big changes in your eating and weight. Your mother is worried, and that's part of why you're here.
Yeah, I felt rejected in my suite and it made me want to control something.
That makes sense. Feeling rejected would leave you wanting some control. When you say control, what does that feel like or look like for you?
It means like eating less, I feel smaller and safer.
Smaller and safer. Thank you for sharing that. I hear sadness and fear when you describe it. I'd like to ask a few brief questions so we can keep you safe and plan care. Are you comfortable with that?
Yes.
Okay, you mentioned sometimes you purged. Can you tell me when that happened and how you felt before and after?
It happened twice after I ate a lot of dinner. I felt better briefly, but then I felt pretty ashamed and guilty.
Thank you for telling me that. Feeling temporary relief followed by shame is common, and I appreciate your honesty. I want to check on safety. Have you had thoughts of hurting yourself or making a plan?
No plans, but sometimes I think that if I disappeared, people might not notice.
I hear you. Feeling invisible can be very painful. Let's agree we'll keep checking in about that and let me know if these thoughts get stronger. Okay? To summarize and just make sure I understand what you're telling me. The transition to college and social rejection preceded increased restriction and 2 episodes of vomiting. You're feeling lonely, sad, and worried about weight. But you want to get back to college and be healthy. Is that right?
Yeah, that's right.
You've said being healthy and returning to college matters to you. On a scale of 0 to 10, how important is it for you to be medically safer and more stable right now?
I'd say maybe a 7.
Why 7 and not a lower number? What makes that important?
I want to be a pediatrician someday, and my mom's worried.
I see. So your future goals and your family's concerns are reason to consider change. At the same time, you found restriction gives you a sense of control, and that's a real tension. If you're willing, I'd like to try um, two short cognitive behavioral therapy strategies today. It's a behavioral experiment to start regularizing eating gradually and brief thought record to test the belief. The belief that I will get fat if I eat. You're in control of what you try. How does that sound?
I can try this snack experiment, but I'm a little nervous.
Nervous makes sense. Thank you for being willing to try despite that. So let's make the experiment specific. For 3 days, try 4 p.m. snack, an apple, a small handful of nuts at the kitchen table. Before you eat, rate your anxiety from 0 to 100. After, note how anxious you feel, whether you had any urge to purge, and what actually happened. What do you think might get in the way?
I might feel guilty, and then I might want to purge.
Okay, that's understandable. Let's build an urge plan. If you feel an urge to purge, pause for 15 minutes, use a grounding breathing exercise, and text someone supportive or use a distraction you've chosen. Would you be willing to try that if the urges come?
Yeah, I can try that.
Perfect. When worry comes, I'll get fat if I eat. We'll use a short thought record. Let's try it together now. What is the automatic thought and how intense is your anxiety about it on a 0 to 100 scale?
The thoughts, one snack will make me gain weight. And on a scale of 0 to 100, like an anxiety, like an 80.
All right, that's what's one piece of evidence that support that thought?
So I used to be a lot heavier before, and people criticized me for it.
And one piece of evidence against it?
I'm currently underweight, and one snack doesn't change my body overnight.
A balanced alternative might be one snack won't cause noticeable weight gain. It can help my energy and mood. If you try that thought now, does your anxiety change?
Maybe to a 60.
Okay, good. That's progress. Practicing this short shift can reduce the pull of the worry over time. You said you feel lonely and have trouble sleeping. What's one small doable activity this week that might lift your mood or connect you with someone?
I could text my best friend from high school, try a short walk after dinner.
Okay, let's schedule the walk for specific days and a specific time. Some nice concrete plans increase follow through. I'll write that in your plan. And if you're willing, let's practice a 1 minute grounding now you can use during urges. We breathe in for 4, hold 1, out for 5. Notice 3 things you can see, 2 you can hear, and 1 you can feel. So we're going to breathe in for 4. 1, 2, 3, 4. Hold for 1 and breathe out for 5. How do you feel?
It helped a little bit.
Okay, good. It's a simple tool you can use when anxiety spikes. So, because purging can be dangerous, here's our safety plan. If you feel the urge to purge and can't manage it after the 15-minute delay and strategies, contact me or go to the emergency room. We'll also monitor labs and vital signs this week. Does that feel reasonable?
Yes.
Very good. So, to summarize our plan, try the 4 p.m. snack, the apple and nuts, for 3 days and record your anxiety and urges. 2, use the 15-minute delayed grounding and a planned distraction if you get the urge. 3, practice the brief thought record when I'll get fat thought comes up. And 4, schedule and complete one short walk and text your friend once this week. With that said, I'll arrange medical labs, an EKG, and a nutrition referral, and I'll wait for you to tell me when you want me to contact your mom. Is anything missing or does that feel okay?
That sounds okay. I'm nervous, but I can try.
I hear your nervousness and I appreciate your willingness. You don't have to do everything perfectly, remember that. Small steps matter. If anything changes or you feel worse, call me or go to the ER. We'll review how the experiments went next week and we'll adjust it together. Okay?
Okay.
Thank you for sharing today. You did hard work this session. Would you like to schedule the same time next week?
Yes, please.
Great. Happy to hear that. I'll see you then. Take care and remember the grounding exercise if you need it.
Okay. Thank you.
Okay.
So that completes Adele as a psychiatric provider, and now we will be switching roles. So I will be the psychiatric nurse practitioner now. Hi, Adele. I'm really glad you came in today. I know this might not have been entirely your idea, so I just want you to know that this is a safe, judgment-free space.
Yeah, my mom kind of made me come.
That makes sense. It can feel frustrating when it feels like someone else pushed you to be here. I'd really like to understand things from your perspective, though. Would it be okay if today we talk a little bit about your eating, how you've been feeling emotionally, and your experience at college? And also just make sure we focus on what matters most to you.
Yeah, that's fine.
So, what's your own take on the weight loss?
I mean, I know I've lost weight, but I don't think it's a bad thing. I feel like I needed to.
Okay, so part of you feels like the weight loss was intentional and maybe even something you wanted.
Yeah, I've always felt kind of fat.
Can you walk me through what a typical day of eating looks like for you right now?
Sure, I usually just eat once a day, like carrots or apples or a salad.
Okay. Have there been any times where you felt like you ate more than you intended to?
Yeah, a couple times. And then I felt really bad after.
What did you do when you felt that way?
I made myself throw up, but only like twice.
Okay, thank you for being honest with me. I know it's not always the easiest to talk about. When you say, I feel fat, what's usually going through your mind in those moments?
That people are judging me, like they think I look gross.
Okay, so the thoughts like something like people are judging me or I don't look okay.
Yeah.
Okay, I'm hearing that this isn't new, that even when you were younger, people made comments about your weight and excluded you.
Yeah. Kids used to call me fat and wouldn't sit with me at lunch or at school.
It must have been really painful.
It was.
And now being at college, where you felt like people didn't accept you again, it kind of brings up those same feelings and beliefs.
Yeah, it feels the same.
So, how has this been affecting you emotionally?
I feel really lonely and sad.
That makes a lot of sense given everything you've been going through. Sometimes when people feel that way, they try to cope by controlling something, in this case, like food. Does restricting your eating feel like it gives you a sense of control?
Yeah, it makes me feel a little better for a
Even
little
if,
bit.
even if it doesn't last?
Yeah.
Would it be okay if we take a closer look at the other thought, that people are judging me?
Okay.
What evidence do you feel like supports that thought?
I just feel like people look at me differently.
And then what evidence might suggest that not everyone's judging you?
I mean, I guess I don't actually know what they're thinking.
Yeah, that's really insightful. Sometimes our minds fill in the blanks in ways that feel really real, even if we don't have full evidence to back it up. One thing I also want to share is that when your body isn't getting enough nutrition, it can actually increase anxiety, sadness, and difficulty concentrating.
Hmm. That might explain why I feel worse.
So on a scale of 1 to 10 or 0 to 10, how ready do you feel to make any changes with your eating?
Maybe like a 4.
Okay, what makes it a 4 instead of a 0?
I don't like feeling this tired and sad all the time.
That's really important. You're noticing something that isn't working for you. What feels like a small, manageable first step that you'd be open to changing?
Hmm. Maybe eating a little more, but not a lot.
Okay, that's a good start. Even adding one small meal or snack a day can make a difference. I'd also like to try something called a thought record with you.
Okay.
So when you notice thoughts like, I feel fat, you can write down things like the situation, the thought, how it made you feel, and then we work on challenging together.
Okay. I'm open to doing that.
You also mentioned feeling really alone at college. Would you be open to trying small steps to reconnect socially?
Maybe. It's hard.
Totally understandable. We'd take it very slow, maybe something like sitting in a shared space instead of eating alone. I also want to check, have you had any thoughts about wanting to harm yourself or not be here?
Not really. Just sometimes I feel like no one would notice if I disappeared.
Okay, thank you for telling me that. And if those thoughts ever get stronger, it's really important that we talk about them right away, okay? Um,
Okay.
Let me summarize to make sure I got everything right. So, you've been feeling really lonely at college, which brought up old experiences of feeling judged and not accepted. And those feelings are connected to thoughts about your body, which have led to restricting your eating. And that's been affecting your mood, anxiety, and energy.
Yeah, that's exactly it.
Okay, so moving forward, we can focus on gradually increasing your nutrition, working on those thoughts about your body, and helping you feel more connected socially. We'll also track our progress together. How does that plan feel to you?
It sounds okay. Thank you for listening.
I really appreciate how open you were today. It takes a lot of courage. You're not alone in this, and I know we're going to work through it together, okay? I'll see you next week, and we'll take this one step at a time.
Okay, thank you.